Your liver can be getting sicker right now, and you may feel almost nothing until the damage is harder to undo. Most people wait for sharp pain, but fatty liver usually whispers before it screams. If you want to stay healthy and independent as you age, hit that subscribe button right now. We share simple, science-backed health tips like this every single day. Here's the thing. Fatty liver is one of the easiest problems to miss, not because your body says nothing, but because the signs feel small, random, and easy to blame on age, stress, or a bad meal. Over and over, people ignore these clues until a blood test, an ultrasound, or a scary doctor visit finally connects the dots. Today, I'm going to walk you through 5 symptom clusters that hide 7 warning signs most people miss, and I'll show you what to do next. Now, before we continue, tell me your age and where you're watching from in the comments. This helps us understand who we're helping. Here's what most people get wrong. They think fatty liver is a drinker's problem. It's not just that. You can barely drink at all and still have fat building up in your liver. Why? Because belly fat, high blood sugar, high triglycerides, and insulin resistance can drive it too. Insulin resistance means your body stops responding well to insulin, the hormone that moves sugar out of your blood. They also think fatty liver always causes obvious pain. It usually doesn't. A 2024 study from Virginia Commonwealth University found that 42% of U.S. adults had fatty liver disease, and many had no clear early warning signs. The same study found the rate was 47% in Hispanic adults. That is not rare. That is everywhere. And let me be clear, quiet does not mean harmless. Fatty liver can move from simple fat buildup to inflammation, then to fibrosis, which means scarring. Once enough scar tissue builds up, your liver stops acting like a soft filter and starts acting like a clogged sponge. That is when symptoms get louder. So if you've been feeling off lately, don't brush this off. Ask yourself something simple. Has your body been giving you hints that you keep explaining away? Let's count down the 5 symptom clusters that hide the 7 signs most people miss. Number 5, constant fatigue. Most people think fatigue means they need more sleep. But actually, with fatty liver, fatigue can show up even when you slept enough. This is not the normal, I had a busy day, tired. This is the heavy, dragging kind, the kind that makes small chores feel bigger than they should. Why does this happen? Think of your liver like a cleanup crew working the night shift. It helps manage fuel, hormones, and waste products. When fat builds up there, the whole system gets slower. Your body may deal with more inflammation, blood sugar may swing more, sleep quality may get worse, and your brain reads all of that as low energy. A 2024 study from Huadong Sanatorium in China found that 51.1% of people with fatty liver reported fatigue, more than half. That matters because many people blame this on getting older and never look deeper. What should you do if this sounds like you? Start simple. For the next 7 days, take a 10-minute walk after lunch and another 10-minute walk after dinner. Not a marathon, just steady movement, then build to 20 to 30 minutes a day. Also look at breakfast. A bowl of sugary cereal can spike your blood sugar, then drop it fast. Instead, try 1 cup of plain oatmeal, 1/2 cup of berries, and 1 tablespoon of chia seeds. That gives you fiber, which helps slow sugar absorption. Add 2 eggs or 3/4 cup of plain Greek yogurt for protein if it works for your stomach. And drink water before you reach for another sweet coffee drink. Sometimes the afternoon crash is not just tiredness, it is a sugar roller coaster. Want one more easy food swap? Use 1/2 cup of beans or lentils with lunch at least 4 days a week. Cheap, filling, helpful. Does that sound almost too basic? Good, because basic works when you actually do it. But wait until you see number 4. Number 4, a dull ache or pressure under your right ribs. Most people think liver pain has to be sharp, but actually, fatty liver usually feels more like pressure, fullness, or a mild ache in the upper right side of your belly. Not a stabbing pain, but a nagging nudge. Your liver sits under your right rib cage. When it gets inflamed or enlarged, it can stretch the thin covering around it. Think of an overstuffed grocery bag pulling at the handles. That pulling feeling can become pressure or discomfort. This is one of the easiest signs to miss because people blame it on gas, posture, or eating too fast. And yes, sometimes it is one of those things, but if it keeps coming back, especially with fatigue, take it seriously. Mayo Clinic and Penn Medicine both list right upper belly discomfort as a possible symptom when fatty liver starts making itself known. So no, you are not imagining it, and no, your body is not being dramatic. Here's what helps most people first. Cut liquid sugar. That means regular soda, sweet tea, juice, and oversized coffee drinks. Liquid sugar hits fast and hard. Your liver has to process the overload. For the next 2 weeks, switch to water, sparkling water, or unsweetened tea most of the time. Then look at dinner size. If your plate is packed and you feel pressure after eating, shrink the meal by about 20%. Use a smaller plate if you need to. A simple dinner could be 3 to 4 ounces of salmon, 1 cup of broccoli, and 1/2 cup of brown rice, or 3 ounces of chicken, 1 cup of green beans, and a small baked potato. And here's a tiny trick that matters. Don't lie down right after dinner. Stay upright for at least 2 hours. Why make that small discomfort worse? Quick question. Have you ever felt that strange pressure or discomfort on the upper right side of your belly? Comment yes or no below. Most people wait for number 1, but number 3 fools them even more. Number 3, you lose your appetite or feel nauseated for no clear reason. That's 2 symptoms in one cluster, and they often travel together. Most people think appetite loss means they are just stressed, and they think nausea means they ate something bad. But actually, when your liver is irritated, digestion can feel off in ways that seem unrelated. You may open the fridge and feel nothing. Food that normally sounds good suddenly doesn't, or you take a few bites and feel queasy. Maybe greasy food hits you harder than it used to. Maybe you feel full too fast. Sound familiar? Johns Hopkins and Penn Medicine both list loss of appetite and nausea as symptoms that can show up as fatty liver gets worse. Why? Because the liver helps manage bile, blood sugar, and digestion. Bile is a fluid your liver makes to help break down fat. When that whole system gets sluggish, your stomach can feel like a sink with a slow drain. Here's what to do. Don't force giant meals. Go smaller and steadier. Try 3 modest meals instead of 1 huge lunch and 1 huge dinner. At breakfast, a simple option is 1 slice of whole grain toast, 1 egg, and half a banana. At lunch, try 3 ounces of chicken or tofu with 1 cup of soup made at home and 1 piece of fruit. At dinner, keep fried food low and lean on softer foods if your stomach feels touchy. Ginger can help some people with nausea. So can slow eating. Take 20 minutes for a meal. Put the fork down between bites. Sounds silly, right? But when you eat fast, your body gets the signal too late. This is also where food quality matters. A 2021 study co-authored by Harvard T.H. Chan School of Public Health found that a green Mediterranean-style diet cut fatty liver risk by about half. In that trial, liver fat dropped by 39% in the green Mediterranean group, compared with 20% on a standard Mediterranean diet and 12% with standard nutrition advice. That does not mean you need fancy ingredients. It means more plants, fewer processed foods, and less sugar can change what is happening inside your liver. Try this easy rule. Make half your plate vegetables at least once a day. Add 1 tablespoon of olive oil. Add 1 ounce of nuts, like walnuts or almonds, as a snack instead of chips. Small choices, big direction change. And if you think, it's just my stomach, ask yourself this. Why is your stomach acting up at the same time your energy is dropping and your right side feels strange? That pattern matters. But wait until you see number 2. Number 2, your belly looks swollen or your ankles start puffing up. That is another 2-symptom cluster, and this one deserves real attention. Most people think bloating means too much salt or a heavy dinner. Sometimes it does, but actually, when liver disease gets more advanced, fluid can start collecting where it should not. A swollen belly from liver disease is called ascites, which means fluid buildup in the abdomen. Puffy legs or ankles are called edema, which means fluid swelling in the tissues, not gas but fluid, not I overate, but my body is struggling to manage pressure and protein balance. Why does this happen? Picture a garden hose with too much pressure inside. Scar tissue can make it harder for blood to move through the liver. Pressure rises, fluid leaks out. At the same time, the liver may make less albumin, a blood protein that helps keep fluid in the bloodstream. When albumin drops, fluid slips into the belly and legs more easily. Mayo Clinic, Johns Hopkins, and Penn Medicine all list abdominal swelling and leg swelling as warning signs of more serious liver trouble. So if your shoes are tighter, your socks leave deep marks, or your waist suddenly grows without a clear reason, do not ignore it. Let's pump the brakes for a second inside this point. This is not the time for a random cleanse tea or a salt-free crash diet from the internet. This is the time to get checked, especially if swelling is new. That said, there are still smart daily steps. First, watch sodium, which is salt. Many people are not oversalting their eggs. They are drinking their sodium in canned soups and eating it in deli meat, frozen meals, sauces, and restaurant food. Start reading labels. Foods with 140 milligrams of sodium or less per serving are lower sodium choices. Build meals around plain foods more often. Try 1/2 cup of no-salt beans, 1 cup of steamed vegetables, and 3 ounces of baked fish or chicken. If you use canned beans, rinse them well. A 2024 study from the University of Missouri found that people with fatty liver inflammation who followed a restricted diet and exercise program improved liver health on imaging and biopsy, while losing about 13 to 22 pounds. That tells you something powerful. The liver can respond when you reduce the pressure on it. Before we go further, if this is making sense so far, hit that like button. It tells me you want more videos like this. And now the final symptom cluster. This one creeps up quietly. Number 1, itchy skin that will not leave you alone. Most people think itching is a skin problem, but actually sometimes it is a liver problem. And here's the strange part. You may not see much of a rash at all. When liver function gets worse, substances linked to bile can build up in the body and irritate nerve endings. Bile is the digestive fluid we talked about earlier. The itch can show up on your arms, legs, back, palms, or even all over. It often feels worse at night. And scratching may not really fix it. A 2021 study from Jichi Medical University in Japan found that 53% of patients with chronic liver disease reported itching. That does not mean every itch is your liver. Dry skin is common. Allergies are common, but an ongoing itch with no obvious cause, especially when it comes with fatigue, belly pressure, appetite loss, or swelling, should get your attention. What can you do right now? Start with the obvious skin helpers. Use lukewarm, not hot, showers. Hot water can make itching worse. Apply a plain, fragrance-free moisturizer within 3 minutes of getting out. Wear loose cotton clothing when you can. Keep the room a little cooler at night. And support the liver while you are at it. Try 1 cup of broccoli or Brussels sprouts with dinner a few times a week. Add 1 tablespoon of olive oil instead of butter when possible. If caffeine does not bother you and your doctor has not told you to avoid it, 1 to 2 cups of plain coffee a day may help some people with fatty liver. Harvard Health notes research linking regular coffee intake with a lower risk of fibrosis, which means scarring. Just skip the sugar bomb version. I'd love to hear your story. What made you click on this video today? Share in the comments. Now let's pump the brakes for a second and talk about when not to wait. I'm not saying this to scare you, but some signs mean you need medical help sooner, not later. If your skin or eyes look yellow, that is jaundice, which means yellowing from a buildup of bilirubin. If your urine turns dark like tea, if your stools turn pale, if you are vomiting blood, if your belly swelling comes on fast, if you feel confused, extra sleepy, or short of breath, call a doctor right away or get urgent care. Those are not watch and wait signs. Also, be careful with quick fixes. Some supplements can stress the liver. Some detox products can do more harm than good. If you take blood thinners, diabetes medicine, water pills, or heart medicine, do not add herbs or extreme diets without asking your doctor or pharmacist first. And if you already have kidney disease, heart failure, or cirrhosis, you need a plan built for you, not a generic internet plan. So you're convinced, but thinking, how do I actually do this? Start with the easiest wins. First, stop drinking your sugar most days. Second, walk 10 minutes after meals. Third, build 2 simple liver-friendly meals you can repeat. Maybe oatmeal with berries in the morning, maybe salmon or beans with vegetables at night. Keep it boring if boring helps you stay consistent. If money is tight, do not worry. You do not need exotic powders. Frozen vegetables work. Canned beans work if you rinse them. Eggs work. Oats work. Plain yogurt works. Tuna works. Brown rice works. Olive oil lasts a while. Healthier does not have to mean expensive. And yes, movement still matters, even if the scale barely changes at first. A 2023 study from Penn State College of Medicine found that exercise training was 3.5 times more likely to produce a meaningful drop in liver fat than standard care. They also found that 150 minutes a week, about 30 minutes, 5 days a week, was the key target. That can be brisk walking, light cycling, chair marching, if that is where you need to start where you are. Look, there's a lot of noise out there. People will tell you to buy a cleanse, cut every carb, or panic over every symptom. You do not need to overthink this. Your job is not to be perfect. Your job is to notice the pattern, get checked if needed, and start lowering the load on your liver. Remember the 7 signs hiding inside these 5 clusters: constant fatigue, right side pressure, loss of appetite, nausea, belly swelling, puffy ankles, itchy skin, not loud, but not meaningless either. Start with just one step today. Replace one sugary drink. Take one 10-minute walk. Build one better breakfast. Your body will tell you if it is working, often in small ways first. Better energy, less pressure, less heaviness after meals. If this helped you, hit that like button. And if you want more videos like this, make sure you're subscribed because we post new health tips every single day. Stay healthy, stay strong.